we are the Faculty of Community and Social Services, and so I think a lot of those same qualities are the things that are really beneficial for folks who are coming into addictions and mental health as well. I would just flag that our entry requirements are a completed bachelor degree. Sometimes one of the questions that comes forward is whether or not it needs to be in a related field like psychology, and the answer is no, it doesn't. Actually, we take folks who have a completed bachelor degree in a wide range of different studies. And then in addition to that, I would say so many of the things that Kelly mentioned, but also the willingness, I think, to sort of lean into the messiness of the work is how I would sort of put it. And so I would say, we're working with people, and we sometimes things don't always, there's not like a specific, if you do A, then B will follow, and if you do B, then C will follow. That's not really how things go. And so I think the ability to sort of roll with things, to be adaptable, to be able to sort of be curious about, how do we make sense of this, and to do that alongside the folks that we're working with. I think that's another quality that really helps people sort of pursue ongoing learning within the careers, because there's always more for us to be learning and growing with. With respects to the characteristics, again, I think it's just staying on top of, I think the course load is actually quite heavy. And so, it does require a pretty high degree of organizational skills to sort of stay on top of all of the different assignments and all the different pieces of work. We have 6.5 courses in first semester and 6 courses in second semester. And so it is a full course load, not caseload, a full course load. And so I think the ability to sort of try to stay on top of things as the program progresses is something else that really supports folks to be successful. We really try to take a focus on holistic understandings and sort of social determinants of health with respect to mental health and addiction concerns. So there are sometimes more medical approaches to understanding addiction and mental health from a sort of a medical framework. And I would say our program tries to really look at how the social determinants of health in the context of people's lives actually contribute to a lot of the experiences and perhaps the difficulties that they have. I would also say that because we are a college program, we are really focused on skill development and implementation. So while we do sort of cover some of the theoretical groundings and underpinnings of various topics, we're really trying to make sure that students feel prepared to go into the workforce, so that when you have someone sitting in front of you who is sharing with you what their struggles and difficulties are, that you feel prepared to be able to support them.